My name's Katie Robert, and I want to welcome you all to live chat, an HFA live chat with Dr. Kelly Fradin. This is part of one of our HFA training offerings for the year. Healthy Families America home visiting program in New Hampshire here is funded by HRSA's Maternal Infant Early Childhood Home Visiting Program, which is housed within Maternal and Child Health section of DHHS. So we're excited to have this opportunity today to open this session widely to parents and support workers beyond just the realm of HFA. Again, my name's Katie Robert. I'm the project director for the training work that we do with the HFA home visitors. And I'm joined by my colleagues, Faith Bouchard and Caitlin Duray, who will be kind of helping monitor the chat, monitor Q&A that come in and any other tech issues that come up. And then, as I had mentioned, the session is being recorded. You will hopefully hear many of the questions that you submitted ahead of time throughout the dialogue that we've planned out for today, but please feel free to type in any questions that you have either into the chat or into the Q&A function. We're also going to have a few quick poll questions peppered throughout the session just to keep things interactive and to keep folks engaged. And then at the end of the session, we're going to have a few quick poll questions just so that you can share what it was like being on the call today or being on the session today. And we're also going to be sharing a link to a form where you can actually request a free copy of Dr. Fradin's book, Parenting in a Pandemic. And we'll be sending out links to a Kindle version of those books. So please join me in welcoming Dr. Kelly Fradin. She is a pediatrician and mother of two living in New York City. Dr. Fradin's work is focused on supporting children with chronic medical conditions and also school health. Although more recently, Dr. Fradin took on more of a public health role in supporting New York City schools with offering health and other parenting education through social media. And last year, Kelly published Parenting in a Pandemic, How to Help Your Family Through COVID-19, which is actually what brings her here today. So her social media handle is Advice I Give My Friends, and you can find her on Instagram and Facebook. I know I've enjoyed interacting with her account myself, and so I'd encourage you all to go and check those accounts out. So welcome everybody, and let's get started. So to help give us a flavor of who we have today, we're gonna launch a quick poll and just tell us, what's the hat that you're wearing today? Are you here as a helper or other family support worker? Are you here as a parent, a caregiver? Are you here as both? Looks like we have lots of family support workers and helpers. That's great. Fabulous. Oh, we've got a caregiver. Someone might be wearing two hats. Wonderful. Okay, so while we wait for the rest of the chat poll to pop up, why don't we open it up to Kelly and Dr. Fradin, if I could just kind of offer an icebreaker, what has been the most aha moment that you have experienced in this last year? And it could be wearing your hat as a mom, it could be wearing your hat as a pediatrician, as a helper. What do you have?
Yeah, you know, I think coming up on sort of our anniversary of dealing with coronavirus, it's had me reflecting on how I felt right at the beginning of this pandemic. And it's like a very vivid memory for me. I was taking the subway to work and in a, you know, just more aware of how close everyone was around me. Because here in New York, we had one case and we had no idea how much it had spread. And we were kind of in that waiting period. And I remember being in the school nurse's office with this nurse who was retirement age, you know, very high risk, and sort of just feeling all this unease and being like, maybe you should go home because I'm worried about you being exposed to this in this small exam room here in the Bronx. And then, you know, shortly after that day, sort of everything shut down. And I was just, along with everyone else, plunged into being home with my kids and trying to work remotely. And then, you know, when 2 weeks turned out to not be 2 weeks, it was very much of a realization of we are going to have a lot to deal with and people are going to need help. So that's kind of how I ended up writing the book and just thinking about the pandemic, yes, of a terrible virus, but then also the pandemic of like the anxiety and the stress that we're all facing. So
Yeah.
that's why I'm glad that you guys are talking about this today.
Yeah. So as you mentioned, this is the 1-year anniversary of our world shifting pretty significantly. And I very much remember getting that email saying we were going to be closed for 2 weeks, and 2 weeks has now turned into 52 weeks. So imagine that through all of this, you have probably a million pieces of advice to share. And we're going to take a deep dive into some of the questions that have come in over the last few weeks, but I want to start a little bit high level. And actually, Eileen had submitted a question perfectly framed for this, simply asking, Dr. Fradin, can you share a little bit about some of the more common questions that you hear from parents?
Yes. So I think right now is sort of a confusing time in the pandemic, because we do have a lot of reasons to have hope that we're going to move past this. We have now 3 vaccines, which are all great options at decreasing the risk of transmitting, and getting really sick from coronavirus. So the rollout, it hasn't necessarily gone as smoothly or as quickly as we would hope, but we do have reasons to think that we're protecting people and we're changing what the next year is going to be like. I think a lot of families are also confused and concerned about what some doctors are calling the scariants, like these variants of coronavirus that we don't know. Some of them seem to be more contagious. And while more contagious is not necessarily more deadly, anytime you have more cases, that means that more people could be at risk of death, right? So we don't think these new variants are necessarily worse at making people sicker, but if they are more contagious, they may cause more cases. So it's basically this race between vaccination and variants. And a lot of my public health colleagues are predicting that we will have another surge. Right now we've seen the holiday surge come down, and we're sort of at this little period of, I don't know what's going to happen. Maybe there'll be another little surge before it goes down, hopefully more long-term. Mm-hmm. So I think that's sort of the context for where we are with the virus. And I think in terms of what I hear from families, I think what everybody wants to know is, what is the next year going to look like? What is our future going to hold? How is this going to change our lives going forward? So I think in terms of the vaccine rollout, when is it going to get down to our kids, and when are our kids going to be safer? So, I think there's a couple of perspectives on that I would share. One is that as we see the total number of cases go down, even when our children haven't been vaccinated, when there are fewer cases in our community, and when more of the adults around our children have been vaccinated, our children will be, safer from getting coronavirus. Mm-hmm. So we won't necessarily reach herd immunity until children have the opportunity to be vaccinated. And that's sort of like the true end that we're aiming for, mm-hmm. is hitting 70 or 80% of the population being protected and seeing coronavirus stop. And we're not going to be there soon, but what we can hope for is that in our communities, because, we're getting 20, 30, 40% of the people protected, we'll see viral transmission start to go down. And in some smaller pockets, we might see if in my daughter's daycare class, most of the parents are able to get vaccinated by next fall, the risk of having a big outbreak there is going to be lower, because most of the kids are not going to catch coronavirus from their families. Mm-hmm. So there's reasons to be optimistic about the direction we're heading, even if it does seem like most children won't have the opportunity to get vaccinated for a while. Yeah. I think we're hoping that teens, sort of the 12 and up group, should be able to get vaccinated maybe by September. And that younger children may have an opportunity next January or so. But even though that's sort of far away still, like I said, I think there's a lot of reasons to be optimistic about our children having, a little more safety and security between now and then.
Yeah, thank you for that perspective. And we're going to be talking a little bit more about kind of risk management and, making decisions about, how safe the kids will be going out and ourselves going out. So I'll be glad to loop back on that. So Chat, or Faith had mentioned in the chat, please feel free to chat in questions or submit them through the Q&A if anything comes up as we're going through, and we'll try to touch on them as we go. So next, if we could just dig in a little bit deeper into some of the questions that were submitted ahead of time. We all know that worries about screen time and remote learning have been primary topics of conversation for what feels like way too long at this point. And so we're going to do another quick little poll here to see who's supporting your learners of any age and any setting, whether it's hybrid, full remote, or just trying to find some positive ways to engage your young kiddos with virtual resources. So we have 63% of people have school-age kids that are full in person. I think I saw a statistic last week that said 40% of New Hampshire schools are currently open 5 days. And I know that just recently, maybe this week, schools were required to be back at least 2 days a week. And I know locally, places that are still hybrid are now rumbling to move back to full open. So great. All right. Thank you, everybody. Okay. So Leah submitted a question wondering about your thoughts on how all of these COVID precautions over the last year, the isolation, the reliance on technology, how are they going to impact our kids when we get back to whatever the new normal will be?
Yeah, I think that's a great question. It's something we've all been thinking about. I think it's helpful to sort of break it down by age, because I think that this time has impacted children of different ages in different ways. So for the youngest children, those under 3, really we know that these children can get most of the things they need at home from their parents. So I don't worry as much about them not having as many opportunities to play with other children, because developmentally, normally they're playing even when they're with other children in a parallel capacity. But what I do worry about for these youngest kids is that if parents are overstretched and there's not as many dedicated caregivers, right? Parents are trying to work from home or manage other responsibilities while the kids are in the household. I worry that they may not have had as much language exposure, right? We know that kids learn language best from other people, not as much from videos or screens. And so I do worry about whether those youngest children have been talked to and talked with as much as they were prior to the pandemic. Because I know that, when I was balancing that with my 2-year-old at the beginning of this pandemic, I was, ignoring her parts of the day so I could do what I needed to do to work from home. And so, we have to think about whether as things open up, those kids need some help catching up to where they should be. For the older kids, like the 3, 4, 5, 6-year-olds, those kids are ones that do have a need to be with other children. We know so much about the power of play in facilitating their social and emotional learning. Those kids cope with anxiety through play. They learn so much about how to interact with other people and about themselves by those back and forth play interactions that are frankly hard for grown-ups to mimic in the home. So I think that as those kids get back into the environments where they have more opportunities, that prioritizing time for play and those kinds of interactions that build friendships and skills at, they do develop your executive function skills, like having to negotiate about what game you're playing with a peer is an essential kind of learning opportunity. So as we open back up, I hope that we'll be able to give those children those opportunities that they may have missed.
And what about screen time? There's so much talk about screen time, and I hear you referencing, sometimes having to use it maybe with your 2-year-old while you were, trying to get work done. And there's so much guilt associated with that. What advice do you have for families who have that on their mind and are worried about what that potential impact might be?
Yeah. So I think some of our conversations about screen time can be like really wrapped in privilege. And so when you look at some of the data about how screen time hasn't been so good for kids, a lot of it is referring to, kids who have 5, 6, 7 hours a day of screen time.
Mm-hmm.
And so I think there's a lot less that's known about the effects of screen time in smaller doses than that. And there is some evidence to show the quality of the screen time makes a difference.
Mm-hmm.
So watching screens with your child, and educational programming, like some of the content from PBS or some of the educational apps that are available, are probably offering children more value than some of the other content out there, like, I don't know, SpongeBob SquarePants or something. But the way I talk about it with my patients and think about it with my own family is that there are some things that we need to have in our day. Like we need to have free play time, outdoor, physically active time. We need to have time to connect with our family, whether it's over a meal or during a commute, when we can interact with each other in a really valuable way. And, we need to do whatever we're doing to facilitate learning. And then after that, after those rocks are in your cup, then if you use screen time to fill in some of the other time, I don't worry about it, because you're prioritizing those things that are important to your family and your children's development. So I would try to tell people to go easy on themselves. And I also, especially for the youngest kids, I don't count FaceTime and interacting with loved ones by video apps as screen time per se, because I do think that you gain some social interaction there. And for the older kids who play a lot of video games, sometimes actually they're connecting with their friends through the video games. And so as long as you're able to make sure that they're not interacting with strangers in an unsafe capacity or accessing inappropriate content, I think that can have value. I know my 13-year-old nephew, it's really his social life is on Fortnite. And so I try to see the value in addition to the risk in that product.
Yeah. So kind of coming back down to the younger kids, we had a question from Pamela that was submitted asking, what can parents do to keep the young kids busy and active during those periods of isolation? Maybe some ideas for things that don't involve screens or other technology.
Yes. So I think that getting kids, especially now that the weather's starting to get better, getting kids out of the house and physically moving is a really important thing. I think it goes together. It facilitates behavior and sleep and health. It reduces children's stress to spend time outside. So, whether it's going for a walk or getting to a playground or just being outdoors, I think is really important for children's well-being. If you are at home, I think there's a lot of value to the arts and crafts, having a creative outlet. And it's also a sensory experience that can be stress relieving for children. Some families also, there's a difference between screens and audio content. So, listening to music or accessing some of the podcasts or audiobooks might be ways to entertain your children with less screens. So those are some of my ideas.
I just noticed the chat. Krian had reflected that her son is also in love with Fortnite and appreciates your perspective on that specific platform, that game. So speaking of being able to go outside and kind of venture out into the world with the warmer weather again, it's a nice transition to talking about how we're managing levels of risk and the levels of risk that we're comfortable taking as it relates to staying home versus going out into the world. And so I know that with the rollout of vaccines and school ending and then coming back up again in the fall, we'll be thinking about this a lot. Samantha had submitted a question. How do I manage the guilt of staying home all the time? We miss extracurriculars. I think.
Yeah, in my book, it's one of the things I wrote about is that parents are dealing with so much right now. And I do think that there's an anger and a grief and a guilt that we feel over not being able to give our children the lives that we thought we were going to be able to give them. So I think there's two things to think about that might help with that. One is that, those options aren't necessarily available for other children either, so to remember that it's not under your control, that it's not like you chose to cancel all the extracurriculars, those options just don't exist. And then the other one is to try to see the value in what, if there's any silver linings to what you have been able to offer. So I'll give you the example of my son. He's 7, and normally pre-pandemic, we loved our extracurriculars too. He did like art and chess and sports after school, and none of those are happening this year. So all he does is go outdoors and he goes to the playground, and he has like, almost 2 hours of just unstructured time. And it's actually been a gift to him in terms of facilitating his physical play. And, he comes out of school where he has to sit at his desk in his little pod where he can't like really get up and move around at school. So he has all this kind of pent up energy after school. And so it's been, there's value to what I've been able to offer him in that unstructured time where he can like have physical play and creative play and sort of space to process what he's dealing with. And it's not necessarily what I would have chosen, but there's still value in it. So I think you can try to see that. And sometimes maybe for other families, it's more meals at home if the parents are more available than normal, more time with your family. Some families have done more board games or had opportunities to teach their children how to do more chores. Like my son learned how to fold and put away the laundry because he had to this pandemic. So to try to flip the perspective, it's not only that you're losing things, but there are things that maybe you've gained, can help you find more peace with it.
Yeah. Oh, I personally appreciate that perspective, is not so much looking at the loss, but what are the things that we've gained and the different angles that we might not have thought about before. So I'm curious, I know we talked about this a little bit at the beginning, but I'm curious about the evolving guidance about sending kids back to school, and also the growing body of data that shows how kids do or don't spread COVID. How do you see the role of vaccines playing a part here? What do you tell parents who are worried, especially parents who don't have a choice between sending their kids out of the home or staying home?
Yeah. Okay. So
loaded question. I can break it back down.
Yeah. So here's the thing. I have since the beginning of this been, a big proponent of keeping schools open, and I think there's a scientific consensus at this point that it can be done safely. The problem is that it takes resources, and it takes planning, and it takes coordination. And so I think a lot of the concerns about reopening have been, about equity. Like some schools are more able to meet the new expectations than others. And so I think that having worked in a variety of school environments, I can see why some families are more concerned, that if your school is very crowded and the ventilation is very poor, and some of the schools here in New York had lead, I mean, these schools may not be as nimble at adapting compared to other schools where they have more space and more resources. So I guess that is to preface that I think we know that children can get and spread coronavirus, and we've known that since the beginning. The difference is that kids are much more likely to be asymptomatic. As many as 80% of them won't show signs, which is a blessing because, children have been less sick from coronavirus overall. And when you're asymptomatic, when you're not coughing and sneezing and breathing hard and having a fever, you're less likely to spread coronavirus by about 50%, maybe more. But when you're asymptomatic, it's also harder to screen you out of going to school, because you don't have any signs or symptoms.
Right.
A lot of schools have put in place temperature screening and questionnaires and such. And while I understand the role of those are not going to be very good at actually getting the kids out, because it's kind of sneaky and insidious. You can't necessarily screen out kids who don't show signs of being sick. So That's why we have to have like layers of precautions in place, the masking, the distancing, the good ventilation that will keep our spaces safe, and prioritizing teachers and adults who are in those environments to get vaccines, because we do know that teachers who are sick are more likely to spread it in school than kids, probably because they're interacting with more students and more staff, and they're adults, and so they're just intrinsically more likely to be spreading it. So, it's a very complicated question. I'm not sure if I addressed all of it, but I think that that for parents, when we're thinking about it through the lens of like our own child going to school, I think it is scary for most parents to think about, especially when you've been home for a long time, taking a risk of putting your child in an environment where they're interacting with more people when they haven't been. And so I think we have to remember that there's also benefits to having the child in school, having the dedicated caregivers, having the social opportunities, having a routine and a structure to their day that provides them with, peace and connection with others and things that are so important to their well-being. So there is risk. I think it's small and manageable for most families. And I think that there are a lot of benefits.
Mm-hmm. Yeah, and I appreciate that last reflection, because I think one of the pieces that we were hoping to kind of get there was, what do you tell the parents? How do you reassure the parents who don't have as much mobility in the choices that they make? So it's good to hear that reassurance. So, all right. So we know that there are lots of groups who have been feeling the impact of COVID, and it's going to take a long time for everyone to recover and get back to some normalcy when this is all said and done. But parents, especially those with young kids, we know are a group who have been particularly impacted by so many parts of our society closing down and slowly reopening. And so we've talked a lot about strategies to support kids, but I wonder if we could talk for a few minutes about strategies to support parents. And we've had a few specific questions that were chatted ahead of time. But again, we're going to start to open it up a little bit. So if folks want to chat in their questions, please do so. There was a specific question that came in, and I'm not sure if Diane is on today or not, but this is a tougher one. And so if you're on, Diane, please feel free to chime in and chat in additional thoughts. But Kelly, we were hoping that maybe you could touch upon tips for supporting parents who may be struggling with or in recovery from substance use disorder, since that is a really important priority population that a lot of our helpers are working with now.
Yeah, I think it's really essential that we focus on supporting parents, because in many ways what's happened has been like a perfect storm for causing parents maximum stress, right? So they're worried about their physical safety, their financial security, their food security, and the well-being of their children. There's so much stress in so many different layers. So before tackling that question specifically, I'd just like to acknowledge that I think it's helpful to view what parents have gone through and what children have gone through the lens of like, it's a trauma. And other pandemics that have been smaller, like the one that happened in Korea with the SARS, we did see that the trauma of going through this type of stress, it causes a lot of harm. And when we think about why, it's probably the isolation on top of all the stress is like a magnifier, right? So when you go through a trauma, it can worsen, underlying issues. So if you take somebody who is already struggling with anxiety or depression or substance use disorder, and then they go through a trauma of this scale, of course it's going to be, an order of magnitude worse. So I think one of the most important things we can do to support these families is to keep them connected. Because when you're isolated, I think is when the impact of the trauma is the worst. probably a lot of you are familiar with sort of the research on ACEs, or like the adverse childhood experiences, and how toxic stress can be so detrimental to our health and our well-being. And I think what we've learned from that body of research is the power of connection. And so the idea that the best way to promote resilience is to, or maybe if it's not the best way, but one of the easiest ways is to have at least one, or ideally like 3 supports in your life. So they've shown that children, for example, when they have more than 3 adverse childhood experiences, if they have those 3 supports, whether it's their parents or their teachers or their grandparents or their neighbors or whoever it is, their doctors, their therapists, that they're much likely to not have the impact of toxic stress. So what can we do to keep these people, even if they are primarily at home, connected to their supports in a way that's like, respectful to what their preferences are, and kind of empowering. So that's how I would approach this issue.
Yeah. Another question that we have, so kind of more taking it back out a little bit more broadly, as things start to reopen, or as things continue to reopen, do you have tips for families on how they can kind of almost like an exposure budget? What are the thinking about which extracurriculars, which activities, which restaurants, which day trips you're going to take? Do you have you thought about, tell me some thoughts on that.
Yeah. So I think as one thing that increases people's stress is having to make so many decisions. And it's like, we never had to think about going to the grocery store as like an exposure risk before. And now we have like all the things we have to do we have to think about a whole nother layer of the risk. So I think as we get more active and we leave our homes, one strategy is to have like a protocol or like a way that you make decisions so you don't have to make so many. So, for most of the fall, for my family, have said like pretty much anything we can do outside, we can do, because we know that good ventilation is going to make the risk low, and so going to the next phase, we're going to have hopefully enough vaccinated people in our community that we can start to think about seeing vaccinated people versus seeing unvaccinated people. And the new CDC guidelines just came out this week about this. The idea that once you've been fully vaccinated, like 2 weeks out from your second dose or 2 weeks out from the Johnson & Johnson vaccine, that you can see other vaccinated people indoors without distancing or masking. So that is going to be a really big change for a lot of people. And it's a good change, but I think it's going to complicate how we think about things. So I would encourage people to be kind to themselves during the transition and take sort of like baby steps. I think it's natural that people will feel a lot of anxiety about resuming kind of normal life. I've heard from many people that they feel uncomfortable with it, and sometimes having like a strategy to cope with that stress can be helpful, like maybe a mantra like it feels weird because it's new, or just because it feels weird doesn't mean it's the wrong decision.
Yeah.
Those kinds of strategies to help you gear up for a change.
Yeah, it's interesting how we've so settled back into this kind of closed off, staying home kind of world, and that feeling of discomfort of venturing back out is something we all have to figure out. So I wanted to also ask a question about the CDC guidance with vaccinated people interacting with non-vaccinated people, but I wanted to call out, we have a question in the chat from Elizabeth, just looking for advice for parents who are no longer together, who have diametrically opposed views on how to handle COVID. And I imagine in a divorce situation, there's home sharing, custody sharing that happens. I imagine that there's probably a lot of households with partners who have different views. How would you recommend? What are some strategies that you think might be helpful there?
Yes, this really peaked around the holidays because whenever people feel their safety is at risk, it can get really heated very quickly. Um, and it can be very emotional because it's like people not respecting something so important to you. Like feeling safe is a core need, right? So if you feel like your safety is in jeopardy, that can be very stressful. And custody agreements also, what you agreed upon initially may not make sense in the setting of the pandemic. So it's very stressful. So I guess prioritizing the needs of the children is the typical advice I give when there's custody disagreements, like really to try to think about what's best for them and focus on what's best for them. And so that's one thing. And then when you have such different views, trying to find a way to communicate despite it. So, to keep in mind that it's not that the other person has it out for you, it's that they have fundamental beliefs that may lead them to different conclusions, right? So maybe you're more cautious because you're worried about the chance of getting a long COVID or the MISC, which is like the severe reaction kids have to COVID sometimes, that's rare. So maybe you have good reason to be concerned, and maybe they're looking at that same information and they're seeing the rates of anxiety and depression in people who are very isolated, and they're more concerned with that. So just, like educated, thoughtful people can have very valid disagreements about what to do. So to try to approach it with respect, rather than being offended by their views, like that their views, aren't necessarily an attack on you, even though it can feel like that. So I think that has a way of like kind of defusing the conflict, excuse me, and hopefully enabling you to have like a more reasonable discussion. So you might say like, you're uncomfortable, so what do you need to feel safe? And then it's about you and what you need. It's not about a critique of them. It's like, I'm more conservative than you, and for me to feel safe with my child going back and forth to your house, I need you to at least maintain this level and to try to compromise and focus on the things that you can control, like, I don't know, asking your child to have consistent rules about masking, for example.
Mm-hmm. So it's negotiating that middle ground, and I'm sure that advice can be applied for many types of difficult conversations. So with the increase of folks being vaccinated, we know there are lots of excited grandparents who are feeling as though they're going to be able to go see their grandkids and hug their kids again. What can you share based on the new guidance about the interactions, kind of the acceptable interactions between vaccinated and non-vaccinated people, and anything that you think that our helpers and the folks on the call should think about, whether it's in conversations with the families that they're supporting or in their own lives?
Yeah, another doctor I know was reading the new guidelines and joking that they were like written for grandparents because they're pro, in general, they're pro grandparents hugging their grandchildren, and that's great. So I guess before you just rush to embrace that idea, the caveats in the recommendation are if anybody in the household is high risk for COVID. So you may have a family with young children and the parent is on immunosuppressive medication for lupus, mm-hmm. or maybe the parent has a heart condition, or the child does, or maybe the child has a genetic condition like trisomy 21 or heart disease, and those families, it's not just an automatic thing to embrace the new guidelines. There should be a pause to think about the risk of the people involved, because younger people are at much lower risk from coronavirus, but some of these chronic conditions can change that. So before just jumping to visit, to consider that the new guidelines they basically say that fully vaccinated people from outside your household can visit, even if your children are unvaccinated, if everybody involved in the household that's unvaccinated is low risk. So, and to be very specific, it only says like 2 households. So it doesn't mean that you can have a family reunion with 5 households coming together, even if all the adults are vaccinated. They say that like 1 household can visit another. So I do think that these guidelines are going to be changing a lot in the months to come. But for now, I hope that that benefit of seeing, you know, the grandparents and some of the support people outside of the home can be a boon to morale, and provide more support to families, you know, sooner.
Yeah.
Also an incentive to vaccination.
Yeah. I know I'll have some very excited grandparents in our family who are itching through Zoom to come hug the kids. So
yeah.
All right. Oh, Caitlin, thank you for linking into the updated CDC guidelines in the chat there. So feel free to click through there. Other questions that we have, let's open it up. Now is the time, and you can chat in your question, add in a Q&A. Let's see. We have a quiet group.
It's a quiet group, that's okay.
All right. Well, I want to thank Dr. Fradin for joining us today. We appreciate having you with us, and we appreciate access to the ebook. So Faith, if you wouldn't mind chatting in that link one more time so folks can request a copy of their book, and we're going to go ahead and just do one quick last poll. This is just to kind of help us plan for future live chats. But please feel free to chat in any last questions or any reflections that you have, but we really appreciate everyone being here today. We appreciate you, Dr. Fradin, and we're glad you were able to make it. So we will be posting the YouTube, the recording on our HFA YouTube channel later on this week. So we will be sending out a link for that when it's available. Any helpers that are on the call today, please feel free to share this link for the ebook and the recording with the families that you're supporting. And we hope you all have a really wonderful rest of your week. So thank you.
And thank you for having me, and thanks for all the good work you do to support families. I'm sure you're making a big difference during this time.
Thank you, Dr. Fradin.